One thing you should know about hair transplant is that many people are afraid of doing hair transplant solely for this reason that they have this concept that hair transplant is very painful procedure. Now, be assured, hair transplant is not that painful, but you have to do the hair transplant from a right hair transplant surgeon, because reducing pain in a hair transplant is a matter of skill, and that requires certain amount of experience. You have to know where the patient is going to feel the pain and we reduce the pain accordingly. Now, this topic about hair transplant pain will be better understood by anyone if they know what pain scale is. So, to get a feedback from my patients, I will ask them how much they are feeling pain from a scale of 0 to 10, 0 being no pain, or 10 being extremely high amount of pain. Now, most of my patients give a pain scale of 2 or 3 after the procedure has been done, which they will grade as the pain they felt during the entire procedure. One of the pain, which not really is a pain, but it's a fear of pain, and it's pain which originates out of imagination. And this imagination is driven by YouTube videos of hair transplant surgeries being conducted. A lot of people see these videos and they get quite a bit afraid of getting a hair transplant done. There are two things which you should know about these kind of videos. One, when you are doing a hair transplant, we are going to give anesthesia. So what you see might be something where you get afraid, but none of it is going to be felt by you. Second is that seeing how a hair transplant is being conducted is of no help to you whatsoever, mainly because you will just get afraid of the hair transplant and you will be driven away. But yeah, of course, people who want to know hair transplant better and who don't have a fear of sight of blood, then go ahead, see whatever you want to see. But in general, if you fear or a phobia of seeing blood, please don't watch these videos. None of these things you will anyway see during your hair transplant, so it makes no sense for you to watch these videos and get pain beforehand. Second type of pain is commonly felt by people is the pain of anesthesia. Now, the way we give anesthesia is by local injections. Now, these needles by which we give injections are very small. You don't generally feel any of these injections. There will be some feeling of small pinches being applied to the scalp when we are giving anesthesia. We have a way of reducing this sort of pain as well. Whenever we apply a quite vibration in the area where we are injecting, that reduces the pain level enormously. Second thing we use is a chilling device. When we chill out the skin becomes anesthetized as it is, and when we are giving the anesthesia injections, it will not hurt a bit. We have another way of dealing with initial anesthesia injections, and that is by distraction. I keep on talking with patients about unrelated topics and keep on distracting for about 5 to 10 minutes where anesthesia is being delivered. Delivering anesthesia takes about 10 minutes, but once the anesthesia is set, you will not feel any pain. A pain scale after the anesthesia is done should be 0. Now, while giving these injections of anesthesia, most people have rated 3 as their average pain scale. So 3 is not that bad. 3 is actually quite acceptable. We start painkillers right away so that it takes care of the pain before it even begins. Before the anesthesia goes away, we start taking painkillers. So pain generally does not last for a very long time, and we continue these painkillers for next 4 to 5 days. Whether there is pain or no, I will advise all my patients just take painkillers for next 4 or 5 days, because you let the pain start and then after that you take a painkiller. It takes quite a bit of time for pain to reduce itself. And as such, if you take painkillers, the pain during next 7 days of hair transplant is barely minimal. And most people have rated 0 or 1 for pain during next 7 days. After the 7 days, there will be no incidences of pain. Some people might feel a little bit of stretching in the donor area. Some people feel a little bit of tingling in the plantar area, but I would not classify that as a pain, or rather that much distracting so that it will require any kind of intervention from my side. So there you go. The pain is not a big deal. Most people will rate pain of hair transplant at the end of the procedure as 0 to 3. I have not yet encountered a patient who has rated it more than 4. So rest assured, you will be fine.